Good evening and welcome to Hunter New England Central Coast Primary Health Network's Quality Improvement Community of Practice webinar on the newly developed Aboriginal and Torres Strait Islander Community Service Directories and how these can be useful to your practice. Firstly, I'd like to acknowledge the First Peoples and traditional custodians of the land in which we're meeting today and honour elders past, present and emerging. My name is Melissa Wilkinson. I'm with the education team with the Primary Health Network. And just noting before we start, we have Quality Improvement Community of Practice at the Primary Health Network. Kate Dinglestat facilitates this. She's our Quality and Improvement Manager at the PHN. And if you'd like to access to any of these valuable resources, please contact Kate either by email or phone. She'll be able to give you some information on how to apply to access the information and resources that are discussed tonight. Please also regularly refer to health pathways, which are kept up to date consistently on a daily basis and as information comes to hand. The pathways are an amazing resource and they have many excellent pathways that are available to help you care for Aboriginal and Torres Strait Islander communities. Back to our webinar content. Our facilitator tonight is Jessica Griffiths, and we'd like to welcome her this evening. Thanks, Jess, for being here. She's one of the PHN's Aboriginal Health Access Officers and is a proud descendant of the Camilla Roy. Is that right, Jess? Have I said that right? Yep. Tribe. And we're really lucky to have her here with us this evening.
Thanks, Mel.
Jess is also a RACGP NACCHO partnership project. She's been involved in that, and they've released the new 715 health check templates in 2020. So she was an integral part of that process. Jess is a passionate advocate for Aboriginal communities, supporting the view that Aboriginal health means not just physical well-being, but being part of an individual who is referring to a social, economic, emotional, spiritual and cultural well-being of the whole community, in which each individual is able to achieve their full potential. Jessica aims to bring together Aboriginal communities, general practice, ACCHOs and community services who share the common goal of creating a more inclusive, sustainable and healthier future through culture, respect, health literacy and knowledge. Prior to Jess's role at the PHN, she was a practice manager at out-of-home care specialist and allied health clinics and was a clinical support officer at John Hunter Hospital. She enjoys fostering productive working relationships and positive outcomes whilst remaining result-focused and motivated to improve Aboriginal and Torres Strait Islander healthcare, patient experience and practitioner knowledge. Tonight, Jess will provide an overview of the new Aboriginal and Torres Strait Islander Community Services Directories, one for the Central Coast region and also one for the Hunter New England region. These directories can assist health providers in having a single point of reference to ensure access to up-to-date information regarding support services addressing the social, emotional, economic, educational and cultural needs of the Aboriginal and Torres Strait Islander community. In terms of asking questions, please write these into the chat box or question box on your control panel as we go, and I'll ask these at the end of the presentation. We've also had some previously submitted, so we'll go through those as well, and thank you for those that have done that. As a reminder to mute yourself for the mics during the session, and there'll be a survey at the end of the webinar, so please fill that in before you log off. That's all my housekeeping done, so I'm now going to hand over to Jess for the presentation. Thanks, Jess.
Thanks, Mel. It's a great introduction. Welcome, everybody. I just wanted to acknowledge the Aboriginal lands that we're all meeting from today as well. We're probably all meeting from different lands and just wanted to acknowledge those lands. I'm joining you tonight from the Wabikal country, and I just wanted to acknowledge the traditional custodians of the Wabikal country tonight and the countries that you join us from, past, present and emerging custodians. So I just wanted to introduce our Aboriginal and Torres Strait Islander Community Service Directories, as Mel was talking about, to assist you in general practice with your patients. So as Mel was saying, the definition of Aboriginal health is quite different to non-Aboriginal definition of health. So it's more about that holistic social, emotional and community wellbeing. So, and as you might find in the 715 health assessment, a lot of those components are those social, emotional wellbeing components as well as clinical. So we notice a bit of a gap there for general practice to assist patients with those social and emotional referral pathways. So you may have heard of the Health Pathways website. So I'll just get started here. So I'll explain what the community services directories are first in comparison to what Health Pathways is, you may have heard of, which is a different entity. So the Aboriginal and Torres Strait Islander community service directories, they can assist health providers in having a single point of reference to ensure access to up-to-date information regarding community service that are available to your patient, support services, addressing those social, emotional, economic, educational and cultural needs of the Aboriginal and Torres Strait Islander community. So as we know, if you have seen the Close the Gap targets, a lot of those do encompass all those components. So there are 2 directories available to have a look at, and they are in line with the LHDs, so the local health districts. So there is a Hunter New England directory and a Central Coast directory. So if I just go over the page here. So I will show you it in a minute, those directories and where to find them. And sorry, my son is going to walk in behind us. You right, buddy? Okay. So different to health pathways. So I'll go into how they're different to health pathways first. So Health Pathways, as you may have known, is a clinically based website that provides clear and concise guidance for assessing and managing a patient with a particular symptom or condition. It also includes information about making requests to services in the local health system. So Health Pathways content is developed collaboratively by general practitioners, hospital clinicians and a wide range of other health professionals and clinical editors, with each pathway evidence informed. So Health Pathways is not designed to be used by patients or the general community. So that's where the difference of these 2 service directories, or well, Health Pathways and the community service directories lies. So the community service directories, their audience are intended for general public, so they are accessible online on the Primary Health Network website, and they're accessible to GPs and nurses on our website as well, and on Health Pathways. There is links to them on Health Pathways. Other useful well, not useful, but schools and community service providers find them useful to themselves as well in determining what community services are out there for their local community. So with these directories, how are services decided upon? So we use a sort of a priority-based system on how we found services for these directories. So at the top of the list, it was listing all the Aboriginal and Torres Strait Islander organisations out there. Then it would be Aboriginal and Torres Strait Islander programs, so any community service that had an Aboriginal or Torres Strait Islander program in it for your patient to refer to, or just recommend to your patient and tell them that it's there, it's available. Aboriginal and Torres Strait Islander identified staff or roles. We did look for organisations out there that had staff in identified roles as well. And at the bottom of the list, they would have had to at least have a reconciliation action plan in place, or in general, you will find some mainstream services on there if they were of benefit to this service directory as well. But this list here is a priority of services of how we sort of filtered out what to put on these directories. So I'll show you now where to find these directories. So if you're in the clinic and you just want to quickly have a look at one, you go into Google or wherever your search engine is and type in the Primary Health Network and click search. So if you see on my screen there, if you type in Primary Health Network, you'll find us here, the phn.com.au. So if you click on that, this is our website. And if you go to programs, on the top of the list here is Aboriginal Health. So you click in that one there. And this is a page that you can go to anytime and look up what services and programs are available in Aboriginal health in your region through the Primary Health Network. So down here, you'll find our community service directories just here on this tab. So you'll find the Central Coast Aboriginal Service Directory and the Hunter New England Aboriginal Services Directory. So as you see there, dated 2020. So this one here is the Hunter New England one. So I'll just bring this up a bit larger on the screen. So you always see what year it was dated. If you ever go into this page, you'll know. So 2020. And I hope that's big enough on the screen. I might make it a slightly bit bigger. So in the contents, you'll see all the subjects here that relate to community services in your region, in the Hunter New England region. So say, for example, you have a patient in front of you that, say, has diabetes, and that diabetes is, in your clinical opinion, needs really looking after, but your patient's priorities are different. Say you have someone in front of you, a lady saying, yep, that's really good, I need my diabetes taken care of, and you've given me all the referral pathways for that, but I'm sleeping on my sister's couch and that's my priority right now. I can't look after my diabetes. What can you do for me in that regard? So this is where this directory may come in handy. So you would say, for example, go to accommodation, and if you click on a subject, it takes you straight to that page. So these pages can be printed out. So you could print it out for your patient and say, here's some services in this region that may be of use. So over here on the left, you'll see the name of the service. So say, for example, renting, home buyers, homeless assistance is all under accommodation. And then it goes into refuges, men's, women's. So these are all printable pages that you can give your patient. There's a bit of a description there of what that organisation or program is, the contact details. And if you see over here, when I hover above something, they are live links. So you don't have to go and try and look up these websites in your appointment. If you want to quickly go to a website, it will take you straight there to quickly show your patient if you like, or have a look for some more details. And over on the far right is the address or the region that service or organisation is in, just so you know, because the Hunter New England region is a vast region. So back up to the contents up here. So you've got accommodation, you've got addiction services. You go to addiction, you've got all the drug and alcohol sort of services, and they may not be in particular a service as such or an organisation. We've also listed websites as well and apps that people can download that could be useful for what they're needing at that time. So there's problem gambling. So they're all under the addiction, also tobacco, a lot of websites, useful programs, carer support, a lot of Aboriginal carer support programs here and useful tools and resources. Community and culture. So this one's a big one. We've got ancestry and family services. We've got community events and significant dates, Aboriginal neighbourhood and community service centres, cultural education and experiences, history and languages. So community can find this useful as well, especially if they might even be from out of town, or they just want to know what's in their local area and connect with community more. A lot of women's groups, elders groups, men's, youth. So community and culture subjects quite big. Education, another closing the gap priority. So we've got literacy and education support, mentoring and careers. Then you've got boarding and financial support, especially those rural and regional areas of Hunter New England. Emergency relief services, so domestic violence, elder abuse, food and vouchers, financial support. So where it says elder abuse, that doesn't mean Aboriginal elders, that means older people in general, elder abuse. Employment, information and support, business support. Families, we've got childcare, we've got family support and parenting programs, playgroups, and relationship support. And in the health section, so if we click on the health section, Aboriginal health workers, so where the majority of the Aboriginal health workers are in that region and whereabouts. Diet and exercise programs are really useful within a 715 health assessment. And a lot of these programs on here are funded. So, but it's always good to check to see if there is out-of-pocket costs, but we've tried to keep these as much as funded programs as possible. So that's quite a big area there, lots of good programs. Sport, chronic disease. So a lot of that you will find on health pathways, but we have just put the integrated team care chronic disease program in there. That is one of our programs through the PHN that is locally based in a lot of service providers in your region. On Track Diabetes program, it's a great website there for chronic disease. Medical expenses, so a bit of information for community there on the healthcare card, Indigenous access line. Counselling and social work, you will find psychology and all the clinically based mental health on health pathways. These are these are more so the lifelines and stuff like that, and apps that people might find useful, and what lies in Aboriginal medical services. Down here, there's some home skills, funerals and sorry business. So they're actually a good resource for that palliative care or sorry business that Aboriginal and Torres Strait Islander people can get access to. Aboriginal land councils. These list all the Aboriginal land councils in the Hunter, New England area. If you want to connect with your local community, like Aboriginal Land Council is a good point of call, first point of call. Justice and legal, discrimination, bullying and racism, elder abuse, leaving custody, a lot of programs there, legal advice and support, offenders and early intervention, some sort of early intervention programs there, sexual assault services, and networks and helplines, and older person support and aged care sort of programs. And as I said, some of this information may be the same as health pathways are available on health pathways, but these are more community-based pathways. All your local health district pathways and information will be on health pathways. So these are just general services, transport services in the region. And another useful one is driver's license. A lot of people have commented they didn't realise how many driver's license programs are out there that are funded for people. So this is a great one for youth or people who have lost their license or don't have a license. It's good to let them know that that's on there if that subject ever comes up. Fuel cards and taxi vouchers. And transport services, especially if your patients are finding it hard to get to the clinic. Good for admin to always have this link to our page as well for our service directory for these sort of services. Lots of services there. And I think that's all. I'll take you back up to the top. But yeah, have a look through it, and by all means, if you notice there's something missing or you want to give some feedback, let me know. And I think that is all I had to show you. So if you wanted to pop the link to that or our PHN website on Aboriginal programs, that will be probably the best way, because then you're always getting the latest version of these directories when you do click on that link instead of saving it as a PDF per se. So I mean, the main reason for these directories as well is a lot of feedback from general practitioners and nurses are unsure what to do when patients do need that community support, and they're unaware of just the programs that are out there. So hopefully this fills that gap for community as well, to know what's out there, because I find a lot of non-Aboriginal organisations will create programs and services for community, for the Aboriginal community, and not communicate that they're there, or can't reach community in that communication channel to let them know that those programs are there. And then, you know, those programs might get defunded or pulled because no one attends. So hopefully that this gets that word out and gets our communities accessing some more services. So I think that's all. And if you want help from the Aboriginal Health Access team at the Primary Health Network on maybe incorporating these service directories into your 715 health assessment and helping your staff with that, we'll be able to help with some quality improvement activities. So just give us a call and hopefully we can come out and give you guys a hand. So thank you, Mel. I think that's all.
Great, thanks Jess. That was really comprehensive and it's a great resource. We've had some questions that have come through and I encourage anyone else that has any questions, this is your time to ask them. So pop them into the chat box and I'll put those through to Jess. And if we don't get them to your question tonight or you think of them later, you can always email me at education@hneccphn.com.au and I will pass on to Jess for her to answer for you. So the ones we've received are, Jess, how often are these updated? How often does it get updated?
Okay, so yearly we're going to update these service directories. So you will find that these ones now are dated 2020. So the 2021 service directory should be coming out, I'm hoping by mid-year. That would be my priority at the moment. But COVID is putting a bit of pressure on a lot of services. But yeah, let's hope that updates out as soon as possible for you guys. And you'll see that as soon as it is available, you'll see the 2021 dated on that directory. So you will know when it's out.
Great, and that's kind of covered. The next question was, when is the next update coming? So
yes. So I don't want to say definite month, but yeah, as soon as possible, we'll hope to get that out, and hopefully by mid-year that's out. Yeah, and great. I might we will send out an email anyway advising that the new update's on there, and create a bit more awareness of the directories as well in the same token.
Okay. Thank you. And how do we let patients know how to find the directory?
So have a yarn to your patient in your appointment, and let them know about the Primary Health Network website and where to find it. I hope to get some cards made up for patients for you to give your patient, so they can take it home and know where to find the directory. So that's not happened yet, but hopefully we can get those made up and make that a little bit easier for you. But at the moment, if you tell your patients, it's on the Primary Health Network website, and just type in the Primary Health Network as I've shown you on the screen, and go to Aboriginal Health under the Programs tab. That should be there.
Okay. That's great, thank you. Thanks for being here with us tonight, Jess. It's been really interesting and I think it's just a fantastic resource. Like I said before, if you've got any questions that you think of after the event, just email us at education@hneccphn.com.au. We are being recorded this evening, and this will be available on our website through the Education Library if you'd like to watch it again later. We'll also have a copy of the presentation up there as well that you can refer to. Also, just a reminder that there will be a poll at the end of when I close the webinar. It will pop up, and we really value your input that we can use for future events. So please look after that and engage in that one. And I think that's about it. Thank you, Jess, once again for being with us. And thank you, everybody else, for joining us this evening. Have a lovely evening. Good night. See you, Jess.
Thank you. Good night.